There are several different causes of bleeding or swollen gums in a pediatric patient. The most common is gingivitis, which you've probably heard of on television many times. This is generally related to poor hygiene. It is important to brush thoroughly along the gum line each and every day, twice a day, to remove the plaque where the bacteria build up to reduce the inflammation in the gum tissue. Gingivitis can be made worse, particularly in children, with chronic dry mouth. So if your child struggles breathing through their nose on a regular basis, has chronic allergies or enlarged tonsils, you may want to consult with your physician. Gingivitis is a little more common around permanent teeth than baby teeth, and that's because the gum tissues around permanent teeth actually are structurally different than that around baby teeth in many ways. So when you are brushing your child's teeth and they have what's called mixed dentition, where there's permanent teeth and baby teeth, it's important that you're assisting them and guiding them so that they're not just brushing straight from the baby teeth to the permanent teeth, because you'll notice that permanent teeth have different heights than baby teeth. So be sure that each and every tooth is brushed right along the gum line. Flossing is important for controlling gingivitis between the teeth because we cannot get to the plaque that is in between the teeth with just a toothbrush. Now for baby teeth, many of those teeth have large spaces between them to accommodate the larger teeth when they come in when they're older. So flossing where spacing exists is not necessary. But if your child's baby teeth do have contacts between them, it can be helpful to floss once each day. There are several other causes of bleeding gums or swollen gums. One of the more common is virus. Many children pick up different viruses that can cause ulcerations in their mouth. They can also cause significant inflammation of the gum tissue, and this will present itself usually as gingivitis or redness and swelling and bleeding of the gums that they did not normally have, and all of a sudden it's in multiple places in their mouths. This is usually also going to be associated with the child not feeling well, not wanting to eat, or not wanting to drink. If you see a rapid onset of bleeding of the gums, it's important that you take your child to the pediatric dentist. Other problems that can cause swelling or bleeding of the gums is a simple loss of a baby tooth. As the tooth loosens and rocks around in the mouth as the child functions, this can cause irritation. This is not anything to be concerned about, but one thing that will often happen is the child will begin to avoid brushing that tooth because it's a little uncomfortable for them. So you may see more gingivitis around a loose tooth than around the other teeth. So encourage your child to carefully brush each and every tooth, even if they are loose. Medical problems related to systemic disease can also cause symptoms of bleeding or swollen gums and tissues. Certain GI diseases, bleeding disorders or blood diseases, hormonal imbalances, autoimmune diseases or a temporary lowering of immunity and the ability to fight bacteria, and certain skin and soft tissue disorders. A pediatric dentist has significant additional training to help identify the cause of gum disease and bleeding, and to develop a plan with you and your child to improve your child's health and prevent the problem in the future. They can also work directly with your pediatrician or other pediatric medical specialist if they feel further evaluation and testing is needed. Don't ignore bleeding or swelling in your child's mouth. If it recurs often or is chronically present, be sure to contact your pediatric dentist for an evaluation.